ready for the microderm step of our facial. What I'm going to do now is actually remove her eye cover. This is because we're going to be going around the eye area itself, and that way we're going to be able to have those areas exposed. I will let the client know that the light's going to be going over their face with the light on, and normally they don't mind as long as they knew ahead of time. So I'm going to go ahead and reapply fresh gloves before I get the microderm machine ready. So during your consultation is a great time to look at your client's skin and decide which tip you're going to use on your microderm machine. Here at Island Skin Spa, we use the diamond tip method. This is basically, it's cut like a faceted diamond, is where it gets its name. And the hole here is connected to a tube, which is going to create suction. And the suction pulls the skin onto the tip of the tool, and then you're going to be gliding it on the skin. So through that method, we are basically in a way using sandpaper to smooth out rough wood, if that's a visual way for you to think about microdermabrasion. So microderm abrasion, micro means small, derma is skin, abrasion means to take off or rough up. So basically we're in a small fashion, we are abrasing the surface of her skin. So I'm getting my machine ready here. It has the tube here that's going to be connected to your handpiece, and you're going to screw the tip onto your handpiece. Some important things to note about the tip itself is that there is a white filter inside. This filter was pre-prepped by me. Basically, you take your tweezer and you're going to take your new filter and you're going to put it into the base of the head just like that. And so when you're done doing the microderm treatment, I'll show you how to take this apart to sanitize and sterilize as well. So I pre-prepped the tip based upon what her skin needs. So we have a few different tips to choose from. They go from 100, 150, 180, 200, and 220. So the lower the number, the stronger the grit. So normally I strive for around 150 or 180 for my clients. Today we're going to be doing the 180 on her skin type because we're actually going to be doing some more exfoliation later. So I'm choosing something that's kind of middle ground to give her a nice smooth exfoliation. And so now I'm going to take this tip and I'm going to put it onto my handpiece. So if your client comes in and it's their first microdermabrasion, you might want to choose the 220, the 180. If it's their third or fourth time, you can go down to the 150, 100. And it's always good to have that consultation with the client because sometimes they actually know about the procedure and they can tell you, I want deeper exfoliation, or you can choose something lighter for their skin based upon your knowledge. So I'm just gonna put these aside. And I'm gonna go ahead and turn on the machine now. So I always start on the center of the forehead here, and we're going to then eventually take the head from side to side. So the machine has this sound that you can hear now. The suction comes through the tip of the head here, and I can see on the machine how strong the suction is. I always like to feel the suction and make sure it's not too strong. If you take the tip onto the client's face and it's not moving very well, that means it's too strong. And if it's just gliding off too fast, it means it's not strong enough. So we'll get started here. So you never want this tube to really be touching the client's face or be dangling on their face anyway, so I always have my hand on the tube in some way, and you adjust that positioning as you go. So I'm gonna go behind her head here now, and I'm gonna move my mag light on top so I can see what I'm doing. So I'm gonna take this hand, I'm pulling her head to the opposite, pulling the skin in the opposite direction of the direction I'm going. So I'm pulling left and I'm going right with the microderm, and you're gonna do this method everywhere where you're doing microderm. So starting on the center line, I'm going to place the tip down on her skin. You'll find that on certain parts of the forehead, as the tip is going over bonier areas, it has a tendency to want to pop off, and you'll have to kind of do those in smaller sections. And I'm finding that in this area here. So I'm going to go to the center area here. I'm going to spread her out the center of her eyebrow, and I'm kind of going just up in this middle line here. With the microderm treatment, you always want to go in two directions. So if I'm going left to right, I can then also go down, and you can see that as I'm going down with the tool, I'm pulling back with my hands. So as I'm going left with my hand, I'm going right with my tool, and vice versa. So once I'm done with the forehead area, I obviously didn't do this spot, but I'm just gonna go ahead and turn her head to the side, holding her ears down. To go this way, on this side of her forehead, I'm gonna show you a technique where I'm pulling down now on her temple area, and I'm taking my tool in and upwards across her forehead this way. With my tool, I'm concentrating on these lines that I can see on her forehead. So from here, I can also go in a downward direction. And now I'm gonna switch to going down her temple area. So I'm gonna move my body position now this way behind my client, and I'm going to pull the temple area towards me, and I'm going to go down and around. From here, I'm gonna start now basically at her cheekbone and going down past her ear. So this index finger here is pulling upwards on her skin while the tool is going downwards. This is keeping her skin taut, and that's a very important part of doing the microderm treatment. The skin cannot be loose, or you're gonna be pulling it around, and then you're gonna either bruise the skin or possibly cause overexfoliation or like the track mark look, and so you don't want that. So we just did this area here, and now I'm gonna go inwards towards her chin, starting at her jawline area. So I'm gonna take my tool basically where I left off here, and then move forward with the tool. So I'm taking the handpiece from here all the way up to basically her chin area, and we'll concentrate on getting her chin area later. You always want to work in like a grid-like pattern. If you see your client wiggle their nose, a lot of times they have an itch, so sometimes I'll just go ahead and do it for them because they maybe don't want to move their arms or something. So it's very important to read your client as you're working. So I'm getting now, moving a little bit closer to her chin area, and I'm taking the tip forward over the front part of her chin. And now I'm gonna take her head a little bit more towards you so you can see, but I'm gonna take the tool and I'm gonna go across her lip, her upper lip, by pulling down here. And you can see I'm just pulling the skin outwards and then taking the tip going upwards to get this whole area right here. We're going to do the eye area later. I'm going to show you how to do that, and we're going to use a smaller head for that section. So now to do across her chin, I'm going to take the tube on this side of my arm, and I'm gonna cock my arm up like this, and I'm going to hold her chin tight, and I'm going to go over the tip of her chin here. You can take your finger and pull up her bottom lip, and then do downward strokes across the top of the chin. So in more difficult areas, you want to work in smaller sections. I'm then going to take her head to the other side and do the exact same thing on the other side. So with the pipe now is going behind her head this way, and I'm going to start by doing this side temple area. From here, I'm going to then go by the front of her ear. By pulling the skin up, you can actually get the skin that's underneath the jaw area, or maybe right here. We don't take the microderm down onto the neck skin as it's really fine and sensitive. Sometimes I will do the chest area, but that would be an additional upgrade. But you can take the skin, and by pulling it up, we're actually able to get a little bit of the skin underneath this jaw line. That is a common area for breakouts, so you will have clients ask you for that. So if they do, just take their head to the side. By pulling the skin back, I'm able to actually get this far underneath her neck. So because the microderm is a rough head, it's obviously going to cause some minor redness on the skin, but you shouldn't see any severe spots of localized redness. This may be an indication that you've gone too many passes over that area. And I'll show you what to do later in case we do see any redness. So you can see I'm taking the tool across the base of her chin, underneath her lip here. This hand here is pulling back towards her ear, so I have constant tension on her skin. From here, I'm taking the tool from basically my pinky across and over her upper lip here. And your hand that's holding should be within 2 inches of your tip. So if my hand's holding here, I don't really want to be microderming here. I want to be very close to the area that I'm microderming. So your hand follows your tip everywhere you go. Okay. So I'm going to then take her head back center, and I'm going to prepare the smaller tip.